Hi, my name is Petra. How are you today?
I'm all right.
I'm going to be doing your assessment, but first let me ask you a few questions. What's your name, please?
Steve Jones,
Okay, what year is it?
2022.
Excellent. And where are we at right now? What facility is this?
We're at the hospital.
Okay, and what brings you in?
I'm having headaches.
Okay, so let's take a look at you here. Let me wash my hands and put on some gloves. So first we're going to assess your sense of smell. Can you please close your eyes and occlude your right nostril with one of your fingers and let me know what you smell.
Toothpaste.
Okay, keep the eyes closed, occlude the left nostril, and what do you smell here?
Toothpaste.
Okay, excellent. So then next I'm going to check your eyes. Please look straight at the top of my nose, right here. Bright light coming. And then the other side. Okay, good. And now, please look at the pen right here. And then focus on the corner of the room and the wall right there. One more time, look at the pen, look at the corner. And one more time at the pen and at the corner. Okay, great. Now just look straight ahead. And I'm going to move the pen coming at you from the side. Tell me when you see the pen, okay?
Now. 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 I already see it. Now. Now. Now.
Okay, great. And now keep looking straight ahead. And I'm going to put the pen right here. With just your eyes, follow the pen, please. Okay, very good. And then I'm going to touch your face now with this cotton-tipped applicator. So it's just a Q-tip, and one end of it is going to be soft, just so you know what that feels like, and the other one is going to be sharp. Do you feel the difference? Mm-hmm. Okay, so close your eyes, please. I'm going to be touching your face in different parts. Let me know if you feel sharp or dull.
Dull. Sharp. Sharp. Dull. Dull. Sharp.
Sorry.
Sharp. Dull. Dull. Sharp.
One more.
Sharp. Dull.
Okay, very good. Okay, and so then next, smile for me. Raise your eyebrows. Make your eyes close, shut your eyes real tight and don't let me open them. Okay, puff out your cheeks and don't let me push them in. Okay, let go of that. Okay, next I'm going to whisper some words in your ear and please let me know what you hear.
1, 2, 3. A, B, C.
Okay, very good. And then next I'm going to take a look inside your mouth. So just look straight ahead, please. Open up, stick out your tongue and say ah.
Ah.
Okay, excellent. And then shrug your shoulders on both sides against my hand. Good. Turn your head towards your left and towards the right. Good. And now stick out your tongue again and move it left and right. Okay, very good. So we are done with the cranial nerve part, and now we're going to move to your extremities. I'm going to ask you to hold your arms out like this in front of you, close your eyes, and count out loud to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, excellent. Don't let me press them down. Very good. Okay, relax your arms. Now with the index finger of your right hand, touch my finger, touch your nose, touch my finger again, touch your nose, and my finger again. Good. Other side, index finger of the left hand, my finger, your nose, my finger, your nose. And you can keep looking at the finger and there you go. Very good. One more time. Okay. Squeeze my fingers as hard as you can. Okay, great. Do a bicep curl. Turn the palms upside down, push against me. Okay, very good. Now let me check your pulses. Good, and your circulation here. Good, and the same thing that we just did on the face, I'm going to have used the Q-tip and ask you if you feel sharp or dull. So close your eyes, please. Sharp or dull?
Sharp.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Okay, excellent. Now place the palms of your hands up, with the palms facing up on your thighs, and turn them up and down as fast as you can. Keep going. Okay, very good. So that is the rapid alternating movement, and then we're going to move on to the lower extremities, but before I do that, I'm going to listen to your heart and lungs here while you're sitting up. So I'm just going to lower your gown here for a moment and listen. Just breathe nice and normally. Okay, good. Next, I'm going to be listening to your lungs. So every time I touch my stethoscope to your skin, take a nice deep breath in and out, please. And actually, let me lower this down here. Okay, deep breath. Again. Okay, now the same thing on the back. I'll just sit beside you for a moment. Nice deep breath. Okay, very good. Next, we'll put this back up and we'll take a look at your stomach here. Actually, are you able to just hold it up here? Good. I'm going to just be listening here for a moment. When was the last time you had a bowel movement?
This morning.
Okay. Any pain when I press?
No.
Good. I'm going to press a little harder. Any pain there?
No.
Okay, good. You can let go of the gown. So next we're going to move on to your lower extremities, and I'm going to check your strength first. Please kick your legs out against me and then pull back. Good. Push down like on a gas pedal and pull your toes to your nose. Excellent. Let me check your circulation. Other side. Okay, and then the same thing we did before with the sharpened dull on the upper extremities. We're going to do this on the lower extremities now. So close your eyes, please, and let me know if you feel sharp or dull.
Dull. Dull. Sharp. Dull. Oh no, that's sharp. I barely feel that. It feels dull, I guess. Sharp.
Okay, very good. And then next for your coordination, I'd like for you to run the heel of the right foot up and down the shin on the left side. And from all the way down to up to the knee. Very good. And do that 3 times, nice and slow. And now switch sides, please. Okay, very good. You can relax your legs. I'm going to check your reflexes here with your patella reflexes. Close your eyes, please. Here we go. There we are, good. Other side. Okay, excellent. So those are nice and equal. And now we'll do a couple of specialized tests here. Close your eyes, please. I'm going to place an object in your hand, and I'd like for you to tell me what that is.
The pen.
Okay, very good. Now keep your eyes closed, please. I'm going to be writing a letter or a number in your hand, in the palm of your hand, and let me know what that is.
It's an 8.
Okay, and now let's check the other side.
M.
Okay, excellent. So this concludes our focused neurologic assessment. Please also check out the other videos about the specifics for cranial nerves as well as the peripheral neuro assessment, where I go into more options of how to assess certain things of the periphery. Thanks for watching Nursing School Explained. See you soon.
Hi, I'm Laura. I'm with the Neuro-Ophthalmology Department at the Moran. We're going to talk a little bit about how to do an eyelid exam today. Really, all you need is an ear card with a ruler or any other way to measure millimeter increments. Okay, so to start out, we're going to position the patient centrally, ask her to look down at the end of the room. Typically, the first thing that we look at in terms of eyelid position in neuro-ophthalmology is whether or not there's ptosis. The way you can measure that is by measuring the distance from the center of the pupil to the lid margin. We call that measurement the MRD1, or the marginal reflex distance 1. So you can hold your near card or your millimeter measurement up, measure from the center of the pupil, and then look at right where the margin of the eyelid falls. In order to measure MRD2, or the marginal reflex distance 2, you take that same measurement, but you go from the center of the pupil down to the lower lid margin. And you can do the same thing on the other side. So the MRD1 and MRD2 should be equivalent between the two eyes. You can also measure levator function, which tests the strength of the levator muscle. So again, you ask the patient, yep, you want to center them just like that. Ask them to look down towards the floor with just their eyes. Good. Measure at the lid margin. And now ask the patient to look all the way up towards the ceiling without moving. Good. And you can put your fingers up on the brow to ensure that she doesn't have any help from the frontalis. Good. Look down towards your toes and up towards the ceiling. So you measure the full lid excursion. Generally speaking, normal is about 12 or more. You can also measure the palpebral fissure, which is the distance between the two lid margins. So again, you just hold the ruler right up there in front, measure between the two, measure both eyes and compare. Typical is around 9 to 10 millimeters. We see a lot of patients in the neuro-ophthalmology clinic with myasthenia gravis, and a really important test for us is the sustained upgaze test. We look to see if we can induce some or a little bit more ptosis by asking the patient to keep their eyes in upgaze for about 30 seconds. So what you're going to have to do is hold the head still, ask the patient to look up, up, up towards the ceiling. You can give them a target with your finger, and you ask them to sustain that for 30 seconds. It's uncomfortable, it's not easy to do, so it's good to continue to encourage them as they go along. Keep looking up, 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 up. I know it's kind of uncomfortable. So we won't wait the whole time, but once you get to the 30 seconds, you want to position yourself directly in front of the patient and ask them on the count of 3 to look right at your nose. 1, 2, 3. Good. And then you want to look and see whether or not the eyelid has dropped. That will only be effective for like a few seconds. So. We also look for the Kogan lid twitch, which is a typical exam finding in patients with myasthenia. So you want the patient to look straight ahead. You can either do this after the sustained up gaze, or you can have the patient look down towards the floor, and on the count of 3, right at my nose. Good. And what you're looking for is you're watching for that eyelid margin to kind of pop up, sort of overshoot, and then come back and correct as she returns to primary gaze. So look down, down, down. Look right towards my nose. Look for an upshoot of the eyelid. Perfect. So today we've talked about the eyelid exam and a couple of different exam findings in myasthenia gravis. I hope you found this helpful.